you, and sharing with Deputy Ryan, please. It's quite clear, I think, that what we have here is a most shocking failure of governance and an inability to protect the public purse from both the Department of Health and the Department of Public Expenditure under their respective ministers. It is simply not credible, Minister Harris, that you didn't tell your colleagues for over 2 months that there was this looming problem, a huge overspend in relation to the hospital. You knew at that stage it was almost 400 million. It is not credible that you didn't tell your colleagues, and if you didn't, you certainly should have. And you know, you haven't answered that. Everybody's coming out with this mantra. You know, you did the right thing. You didn't do the right thing, and that's quite clear. But let's go to the 9th of November. On the 9th of November, you talked about the government taking a decision based on 3 options. Now, first of all, Minister, I'd ask you, can you present the basis on which that decision was taken, including the costings involved in each of those options? But of course, there's a 4th option. And the 4th option is something that should have been looked at and still does need to be looked at. And that is the option of halting this project and going elsewhere, starting again elsewhere. Have you costed that option, Minister? And particularly, you know, you talk about clinical importance. The clinical importance in respect of ensuring that this project is brought in, along with the long-promised maternity hospital on that site, have you costed what's entailed in providing a maternity hospital on that site, which I understand will have huge expense involved with the difficult site, but which will also entail knocking some of the existing buildings in the general hospital. So have you considered that? Have you done the costings on what it would mean to halt the project at this stage and build the children's hospital and a maternity hospital in an alternative location? And I have to ask you, Minister, are you aware of the fact that in Hamburg, just in the last year, a children's hospital with almost 150 beds was built for €70 million. In Helsinki, a 140-bed hospital was built for €170 million. You know, that would bring our hospital in at about 400 million, a very, very long way from what you're talking about at the moment. So have you done the costings on each of the options that were before you, and have you costed the possibility of moving to another site?
Questions there. I'll answer them as quickly as I can so as not to take your time. I didn't know about an overrun of potentially 400 million, but we won't debate that point. But other than to say it's quite clear that some of that was a claim from a contractor that wasn't accepted by the board, and actually through very robust negotiation action, as opposed to the inaction people like to suggest, that was reduced. Sorry, I won't interrupt your time, but it was reduced. The 200 million was actually reduced to 60 million. So it actually shows how coming in here and putting partial information on the record of the House or partial information to the Minister for Finance doesn't lead to better decision making. You asked what were the 3 options. I published the documents that outlined them last Thursday. You asked me what the 3 options were. I believe you did, but if you didn't, that's okay. The 3 options, and indeed the reference in relation to the impact they'd have on delaying the project and the impact they'd have on additional cost to the project, are outlined on page 2 of a memo dated the 9th of November, which I published last Thursday in relation to providing people with full transparency. You asked me, did I know about Hamburg? I'm not familiar with that specific project. I'll make myself specifically aware of it. But we did provide to the Health Committee, and it is a publicly available document now, the ACOM report, where we actually looked at international comparisons in terms of the cost of this hospital with other hospitals of comparison. And if you actually look at it, this hospital will come in at 6,500 per square metre, according to ACOM, compared to 9,000 per square metre to build an equivalent children's hospital. You, as a former Minister of State in my department, and good work you did in it in relation to primary care, know that it's not all about beds. It's an awful lot more in relation to beds. So beds is not a fair comparison when you look at square metres. And what I certainly haven't done is cost moving this to another site at this stage, because we made that decision. In fact, the last government, Fine Gael Labour, made the decision in relation to the site. I believe it's the right decision, and we've already invested €235 million of taxpayers' money in delivering it. On the maternity hospital, I don't have the costings here this evening, but I will certainly be happy to provide them to the Deputy.
Deputy Róisín Shortall.
In the cost of the maternity hospital. I want to ask very briefly, in relation to the head of the Office of Government Procurement, can you clarify that he would have been in a position to actually inform his minister of the cost overrun, that he wasn't a company director?
A question for...
I'm unaware of what his status is from a company law point of view, but because as far as I know, what he is subject to was the standards that he would have as a civil service and the different circulars that, for example, were raised there by Deputy Kelly, which he's questioned me on. What he had to do, I'm going to answer the question, and I'm going to answer it to the best of my ability this evening, Count Corla. According to the circular that the head of the Office of Government Procurement was subject to, it was his role to ensure that the parent department who was responsible for the project were being informed of what was happening, and that was happening. And then, at the appropriate point, Deputy Harris then became aware of it, and then he briefed me on it, and we took action from there.